My name is Giselle Molina, and this is an informative speech. I'm going to inform you on the multiple benefits of birth control. When I'm done with this presentation, I'm hoping the audience will be informed about all the benefits that are contributed to birth control pills. As you all know, initially birth control was created and designed for contraception, so you can plan pregnancies, family planning, and things like that. Now it is used to treat many different conditions that we have developed over the years. Did you know, according to NPR, more than 1.5 million women in America use birth control pills for a reason other than pregnancy prevention? These birth control pills now are used to treat different conditions. We use them to treat irregular cycles, painful menstruation, endometriosis, which is a condition that causes severe pain, debilitating pain that will cost you or limit you from doing your daily things. Polycystic ovarian disorder, which is another condition that it affects women. Acne, premenstrual syndrome, this up and downs and emotions where you feel like you're not yourself. It's something that goes on with your hormones, and it's not something that it's wrong, but it's something that we can help. So according to the CDC, 62% of birth control pills are used for contraception, and 14% is used for other reasons, like the ones I explained. Also, polycystic ovarian disorder is a hormonal imbalance, and it also affects your metabolism. So this is something that affects 10 women of childbearing years, according to womenhealth.org. Birth control pills, patches, will help you balance that hormonal imbalance that you have, and then will also help you be able to better control that metabolic issue that comes along with the hormonal imbalance. This is a condition that will cause women to have increased facial hair, screen darkness in some areas in the skin, difficulty conceiving and controlling their periods because you're not ovulating properly. Your ovaries have cysts that are, multiple cysts that will prevent you from having a normal cycle. So having birth control pill to help you balance and keep your hormones balanced, it's a great option. Also, birth control pills have shown to lower the risk for cancer, according to the American Cancer Society. Women who use birth control pill and stay on birth control pill for longer periods of times have a reduced chance of having ovarian and endometrial cancer, which are cancers that are very difficult to diagnose because the range of symptoms that are associated with those cancers are very similar to painful menstruations, irregular cycles, irregular bowel movements, things that we can ourselves associate the symptoms to, without going to the doctor and having a full evaluation. Not necessarily that during that evaluation it can be fine. So most of these cancers that are so high risk and difficult to diagnose will be, if you have the option of decreasing those chances, if you also have higher risk from familial tendencies, then that will be a great benefit to you. So to summarize, birth control pills, as you know, were initially created for contraception, but now we have all these different things that we can treat. We can regular cycles, we can reduce the PMS that is difficult to manage on its own. be able to balance your hormones and keep you regular, and be able to help us, do things that we need to do. So being informed, asking questions, not, not feeling limited because it's birth control pills that you cannot use it because you're this age or that age. Those are all things that are now misconceived, and there's great benefits on using birth control pills for young women, older women, perimenopausal women, to help them with all these transitions that we have to go through in our lifetimes. So now I'm going to show you different, let's see if I can show you the different options that we have. So those are the pills that are the easier to manage, which is a daily pill that you would take. We have the NuvaRing, is something that you put in vaginally yourself for 21 days. You have the patch, which is also easy to use, but it's difficult to keep in place since we shower every day, we go to the beach, we live in Miami, so it's difficult, but it's a good option. We also have a subdermal implant. It's something, it goes in your skin and you have there for 3 years if you choose to. You have the IUD, hormonal and non-hormonal. The one with hormones will benefit most of the conditions that we said, because you need some hormone to assist. And we also have this injection, which is an intramuscular injection that can be used, and it's a progesterone only medication for those people that are limited to only one hormone that you could use to treat those conditions. So those are the things that you can use, and I hope this speech was very helpful to all women out there and young women that are looking and are dealing with these conditions. Thank you.